Hello and welcome to Legacy Healthcare Services 20-Minute Tune-In. This is our October 2016 edition, and today we will be discussing the benefits of Chair Qi. Thank you for taking time out of your busy schedule to tune in to this webinar. I am pleased to introduce you to Nicholas Cruz. Nick is a physical therapy assistant as well as the rehab director at the Lodge at Wake Forest, which is located in North Carolina. He has been with Legacy for about 2.5 years. So Nick, thank you so much for being here today and sharing your knowledge with us.
Thank you for having me.
Absolutely. All right, so the objectives for today's call. Nick is going to share his knowledge of Chair Qi, how it's being used in his community, and why it is such a beneficial program. So out of the webcast today, we want you to really have a better understanding and definition of the purpose of Chair Qi, and then be able to name 2 benefits of Chair Qi in the older adult population. So let's get started. So Nick, as we talked a little bit earlier, and I was doing my own research into Chair Qi, I wanted to just start with the basics because I'm not sure how many therapists really know what Chair Qi is. So can you enlighten us a little bit about Chair Qi and the background behind it?
Okay. Yeah. First, I'll start with kind of the definition of Tai Chi, and I will use Tai Chi and Chair Qi kind of interchangeably as a term because, for the most part, it is the same thing. With Tai Chi, you're standing. Chair Qi, obviously, the resident, the patient, is going to be in sitting. So Tai Chi is just a type of martial art that is very well known for its defense techniques and health benefits. The art has evolved over the years into an effective method of reducing stress and anxiety. It is considered to be a form of meditation and motion which promotes serenity and inner peace. Chair Qi, like I said before, is an adapted form of Tai Chi that allows participation in movements while seated rather than in standing. And Chair Qi and Tai Chi combine flowing movements with rhythmic breathing to benefit the entire mind and body.
Fantastic. Let's talk a little bit more in detail about Chair Qi or Tai Chi. Is this sort of activity considered to be a high-impact activity, or would it be considered low impact?
Yeah, it is. It's a very low impact, which I feel like has brought in a lot of our residents to this exercise because they do enjoy that low-impact exercise. The overall motion of both Chair Qi and Tai Chi is very slow and controlled movements. The participant focuses on deep breathing in combination with slow circular movements. The muscles will always be in a relaxed state rather than tensed, and the joints are not fully extended or flexed. In addition, the muscle tissue is not stretched as it is in strength training. So there should be very limited to no soreness after participation, even though we will see some strength gains happening.
Okay. Well, that sounds like it's appropriate for a lot of the residents that we interact with then.
Yeah.
Okay. And what about the room environment? I'm assuming since it's a relaxed type environment, then the room is going to be kind of a low stimulation versus high stimulation. Is that accurate?
Yeah, that is, and we try and control how much activity is going around so the residents do feel relaxed. Of course, it's difficult when you're in an activity room to be able to control that fully, but we try and have lights very dim as much as we can and control any type of noise that's going on the outside.
All right, so you had mentioned there are strength benefits and the meditation aspect of Chair Qi. What are some of the other benefits of Tai Chi and Chair Qi?
So probably the strength benefits are kind of secondary. The big thing you get is both You obviously get the mental and the physical. The big thing you get with Chair Chi is a mental improvement. You see improvements in affect, overall life satisfaction, and well-being for those that practice Tai Chi and Chair Chi. Also, we'll see a reduced psychological distress, which is a big part of Chair Chi. And then for the physical side, we'll see decreased blood pressure, improved deep breathing, improved muscle strength, decreased fatigue, decreased pain and stiffness in the joints, and just overall improved range of motion of the body.
Excellent. Do you have any Chair Chi success stories that you could share with us, Nick? I
do. One, I do like to brag about this one, but we have a resident here that hadn't seen a doctor in probably 2 or 3 years. She's kind of against the lab coats. She gets very nervous and tense, so she just doesn't go to a doctor. After lots of prodding and begging her to come in and just to try it out, she stayed with the Chair Chi program. And when we got about 2 or 3 months into the program, she actually went to see a doctor. She came on to physical therapy with us, and someone who has been opposed to exercise for a really long time, she'll come in every other day to our office, and she'll do her exercises just to make sure she has someone around to make sure she's safe. She'll come in and do her exercise, and she's kept up with those ever since she started the Chair Chi program.
That's fantastic. And how often do you offer the Chair Chi at your community?
I do it once a week, and we go for about a half-hour session.
Okay. So for those of us, I say us because I'm including myself in that, I've never experienced Tai Chi or Chair Chi. So can you talk a little bit about what your session looks like, what type of movement somebody might expect, and what the goal or the focus of those movements are?
Yeah. So first, I mean, it's pretty general. First, we start off with getting the body warmed up, doing shoulder circles, neck stretches, and along with just some simple breathing techniques, breathing in through the nose, out through the mouth is a big stress that we talk about, because that does help clear your mind, helps prepare your body for the movements that we do. And then we'll go into the Chair Chi forms, which entail a lot of rotation movements, rotation of the spine, and a lot of pushing and pulling. So you'll see a lot of breathing in through the nose, and you're kind of pulling your arms to you, and then you're breathing out through the mouth and pushing out that bad energy. And with Tai Chi, Chair Chi, all the movements flow from one form to the next. So it's a very, very beautiful exercise. And then at the end, we'll go through just some gentle range and back in through the breathing again, and just really focusing on clearing your mind, clearing all your stresses that the resident may have. So it's very relaxing, especially at the end of the session.
It sounds like it would be. For those residents that might be a little hesitant and maybe not are familiar with Tai Chi or Chair Chi, is it something that is learned progressively over time and the movements can be modified, or is it kind of you have to be very strict with how the movements are maintained and performed?
No, and I think that's a great thing about Tai Chi is that you can adapt the movements. Of course, if somebody has decreased shoulder range of motion, any problems with their spine, they're not going to be able to rotate and lift their arms as high as you would see in the proper form, but they can do what they can do. And that's one thing I stress. If you can't do everything, that's fine. Just do the best you can, and like I said, do what you can do. So, really anybody can do this.
Fantastic. All right, so I know that yours is a little bit of a unique story, so I would like for you to share, you know, how you got interested in Chair Chi or how it came about in your community, because as far as I know, it's not a typical treatment strategy that's taught in PT, PTA, OT, OTA schools. So talk a little bit about your introduction to Tai Chi and then how it became a consistent program at your community.
Yeah. And to be honest with you, I didn't really know anything about Chair Chi or Tai Chi before I got into this here. One of the EDs had ordered the program through her company, and it just came in a DVD. And she put it on my desk and asked me to check it out and see what I thought, which I did, and I figured it could be beneficial, get some new people in, because I have had some of our residents ask me about doing some yoga, some different type of exercise. So I didn't need to promote it too much. I put out some flyers, made sure every resident had a flyer. I did a lot of word of mouth, going up to talk to people and let them know what we were doing something different, because I know a lot of times in my adventures to try and get people to come to exercise class, they didn't want to do it because it was too stressful, it was too much work, whatever it may be. So I really promoted that this is a relaxing exercise class, something to get them moving but still try and keep them stress-free. So the DVD that I received, it was called Chair Chi with Pat Griffith. We did that for about 3 months, and that was honestly, for me and I think my residents, a great DVD to start with, because it's very short in the movements that he does. So the DVD is about 30 minutes long, but it only takes 10 minutes to get through the set of movements he does. But what he does is breaks them down into steps. He'll go through them. He'll explain what the movement is, the name of the movement. And then in the second portion of the DVD, he'll just talk strictly about the breathing while he's doing the movement. And then in the third step, he puts it all together and you do it the best you can. So it's really great that he broke it down. And like I said, we did that for about 3 months, and then I could tell my residents were starting to get a little bored. So I was able to find a new Chair Chi video on Amazon Prime, which worked out really well, because with this particular DVD, our program, I should say, he spoke more along the lines of the health benefits and what each movement represented. So different movements would help the digestive system, the cardiovascular system, and he really got into that, which was great information for myself and the residents.
Absolutely. How interesting.
Yeah.
So this gives me hope that anybody can really take this and kind of run with it in their community. And so based on what you've said, I'm getting the visual picture that you kind of were set up in your activity room, you had the DVD going, and then you kind of acted as the moderator between the video and the participants, helping them to make sure they understand the instructions. Would that be accurate?
That's correct. Yeah, it allowed me to adjust the residents if they needed help with the form, if they weren't quite understanding how to do the motion. So yeah, it allowed me to walk around and do that. Okay, great.
So I know you've touched on the benefits of actually participating in Tai Chi or Chair Chi, but what have you noticed in the community because you offer that? Is there a difference in the residents, or what positive things have you noticed because of the addition of that class?
It really helped me build a stronger relationship with the residents in the community. I felt like we had a strong relationship, but this since I didn't know a lot about Chair Chi, it allowed me to learn with them, and it put us in the same boat as me not being strictly the teacher of the exercise class, but I was learning with them, and we had a lot of the same questions, and I'd go and find their answers, our answers to the questions, and so it really built a stronger relationship with the resident and community as a whole.
Excellent. And were you able to, you know, generate any kind of referrals to your therapy services because of the Tai Chi program that you might not have otherwise?
Yeah, and like I said earlier, it brought in a lot of people that I might not have had a contact with to see what deficits they had. I would get some decreased range of motion, especially in the upper extremities, some decreased balance, core strength deficiencies, and just you can tell with decreased range of motion, you can tell the people that would have difficulties with some ADLs.
Sure. Now, do you, have you been able to use any of the Chair Chi movements within your own treatments, or do you kind of keep those separate?
I do keep them separate. If somebody has, of course, decreased range of motion in their upper extremity, we'll stretch out their shoulders, stretch out their arms, which then will obviously help them when they come back into the Chair Chi. So it's just, we don't specifically use any Tai Chi or Chair Chi in our treatments, but they correlate together to where they'll see benefits when they come back down to the Tai Chi, to the Chair Chi class.
Okay, and that was going to be my follow-up question. Then, when you have identified somebody from the Chair Chi program, and then they start with therapy, are they doing both their tailored therapy and Chair Chi at the same time, or is it something where they're kind of out of Chair Chi until you can get movement patterns resolved, and then they go back into the Chair Chi program?
No, they'll do them at the same time because they'll still, even if they can't do the full movement, the full range, they're still going to see benefits, if anything, with their stress level.
Great, and not to mention the added benefit of the social interaction and engagement with the other residents.
Of course, yes.
So, one last kind of question to follow up with the program. What kind of advice would you have for somebody that doesn't currently have a program like this but may be interested in adding it to their wellness schedule? Where would you direct them to start, and you know, kind of the successful points of your adventure, if you would mind sharing those?
Yeah, and the big thing is, like I said, I didn't know much about Tai Chi when I started. Just give it a try. It's never going to hurt to try something new. A lot of the residents that I find in my community are getting more interested and have more questions about more of the, I guess you could say, the Eastern medicine, the yogas, the Tai Chis. So, I mean, give it a try. I would average in my just kind of general normal exercise class 6, 7 people on average for each class. When I first started this, my first 2 months of classes, I would have 19 and 20 residents. So the interest is out there. They just, some of them need a push to come in, but it's a very good exercise, because a lot of times we don't focus on in our exercise class the full range of motion and even stress relief. So this is a big thing, I think, for the residents, is a stress relief. We might not feel like they have a lot of stress in their life, but they do. It's just a different type of stress that they have compared to what we have.
Absolutely.
So the big thing is just give it a try. You're not going to be any worse for wear.
Well, and I think, too, that the fact that you're not using any type of equipment or, you know, TheraBand or anything like that may target some of those folks that may be intimidated by the weight or movement patterns that seem so foreign. And from your description of the movement patterns, everything is, you know, it's that calming versus kind of that excitatory response that we sometimes get from muscle strengthening. Would you say that that's an accurate statement?
Definitely, it definitely is.
Okay, fantastic. Well, Nick, I sure appreciate you joining me today. I know that I have learned a lot from you, and I am so thankful that you took time out of your schedule to share with us. Is there a way that Legacy employees can reach you if they have specific questions about Chair Chi?
Yeah, definitely. I mean, anybody can call me anytime. They can email me. My building number is 0211, so feel free at any point to call or email me, and I can definitely get you pointed in the right direction.
All right. Thank you so much, Nick. We will have our next 20-minute tune-in for November. The topic for that call is going to be painting a picture with your documentation. So a lot of information really focusing on the daily note and how to be concise, but at the same time create a nice picture for reviewers and others that may be looking at your documentation. So Nick, thanks again, and have a great day.
Thank you, you too.